Today we're looking at RETATRUTIDE, the most comprehensive metabolic peptide in its class. It's a triple agonist, meaning it activates three different hormonal pathways at once: GLP-1, GIP, and glucagon receptors. This makes it a major step beyond earlier compounds like semaglutide and tirzepatide. Here's what each receptor does. GLP-1 slows gastric emptying, reduces appetite, and regulates insulin. GIP enhances insulin release, improves glucose tolerance, and helps fat metabolism. Glucagon stimulates energy expenditure and drives fat breakdown, also called lipolysis. Together, these three pathways cover appetite, glucose control, and fat burning. Here's why this matters. In clinical research, semaglutide produced 17% body weight loss over 68 weeks. Tirzepatide hit 24.7% over 72 weeks. RETATRUTIDE reached 17.5% in just 24 weeks, and 26.2% in 48 weeks. So not only does it produce more total loss, it does it significantly faster. Beyond weight loss, RETATRUTIDE has additional research-reported benefits. It shows anti-inflammatory effects, may support collagen synthesis and skin tone, accelerates wound healing, promotes angiogenesis for better circulation, and activates satellite cells for muscle regeneration. Emerging research is also exploring RETATRUTIDE for cardiovascular health, non-alcoholic fatty liver disease, neurological conditions like Parkinson's and Alzheimer's, and even sleep apnea, substance use disorders, and depression. Possible side effects, common and mild to moderate, include nausea, vomiting, headache, indigestion, constipation or diarrhea, abdominal discomfort, and dehydration. Most of these are dose-dependent and tend to fade as the body adjusts. Rare but serious effects include gallbladder issues such as gallstones, pancreatitis, severe allergic reactions, intestinal blockages, gastroparesis, and kidney strain in those with existing kidney disease. Higher doses and longer durations increase risk. To manage side effects, avoid fatty or greasy foods, stay hydrated, stop eating once full since satiety comes earlier on these peptides, dose at night, and use fiber supplements to avoid constipation. If side effects are too strong, the dose can be started lower and titrated up gradually rather than jumping by full 2 mg steps every 4 weeks. Drug interactions to be aware of. Combining with other GLP drugs raises pancreatitis risk and accelerates desensitization. Combining with insulin or insulin-stimulating drugs like glipizide or glyburide can cause hypoglycemia. And because RETATRUTIDE slows digestion, it can affect absorption of oral medications including birth control, antibiotics, thyroid meds, stimulants, and pain medications. Use caution and seek medical supervision if you have a history of pancreatitis, gallbladder disease, or a severe GI disorder like gastroparesis. Do not use RETATRUTIDE if any of the following apply: you're pregnant or nursing, you have chronic kidney disease, advanced liver disease, severe GI disorders like Crohn's or IBD, you or a family member has a history of thyroid cancer, or you have a known allergy to peptide medications. One critical note: do not microdose or split dose RETATRUTIDE. At very low doses, you partially activate GLP-1 but underactivate glucagon, creating an imbalanced signal. The result is weaker fat oxidation, less appetite suppression, less weight loss, and more side effects. Split dosing also accelerates desensitization. Use the full protocol or don't use it. This video is for educational and research purposes only. It is not medical advice. RETATRUTIDE is an investigational compound, not currently approved for general use. Laboratory peptides are intended strictly for research and not for human consumption. Always consult a licensed healthcare professional before making any health decision. Thanks for watching. If you'd like a deep dive on another peptide, drop a comment with which one.